the young people out there, arm yourself with the right knowledge. Arm yourself with the right knowledge. Get tested and know your status. Even testing is freely available. Use protection during sexual activity. And young people out there, I know that there's a lot of you know sexual activities going on, and sometimes people do not think about the health. But please think about yourself first. Think about yourself first, because you will always have someone good in your life going down the path. So condoms must be your best friend. So talking about arming yourself with knowledge, and just a good example with condom. A lot of people say condoms have holes. These are I would say myths or false information spread. And when you have a social media where like Facebook, a lot of information are not true. So people need to arm themselves with the right knowledge and make informed decision. And like we said, or I said, it's also okay to wait until you are ready and choose your partner carefully. It's not wrong. If your other peers have run faster than you, it's okay, take it easy. That best person will come. So we need to make that important decision for ourselves, so that we are not, we don't become a statistic, but we do become an example. So most importantly, communicate openly and with your partner about sexual health. So if you're in a relationship, if this is a new relationship that you are forging, make sure that you are tested so that you trust each other. And if someone suddenly is exposed to a risk, that person needs to go and quickly test so that you are safe in your safe space. For TB, we have close to between 46 and 50,000 people who are diagnosed every year. So in 24, there's the number. So you have so many people, about a significant number of people, about 126 per day. So you can see that there's lots of people diagnosed with TB. And then TB is a treatable disease as well. So HIV and TB, we are working close to each other to make sure that, because when someone catches HIV, they have a high chance of catching TB as well. And then when both diseases are in one person, the drug pill burden is so huge that a lot of people do not make it through. And the death rate is very high across country. The case fatality rate for TB is very, very high. So you have 14 to 16 people dying every day. So the health minister has declared TB as a war. Is declared a war against TB. So for anyone who is coughing, please, if you're a young person out there coughing and you're losing weight and you don't feel well, just go to the nearest hospital and give your sputum, and they will test you. If you are tested, diagnosed with TB, be true to your treatment, stay close to your treatment for 6 months, and you should be treated. TB is a treatable disease. HIV is a manageable disease. I don't call it a treatable disease. It's a manageable disease because once you get treatment, it suppresses the virus and ensures that improves your quality of life, and you can live longer. Like my friend who's now lived nearly 23 years. So it's important to make sure you're tested for TB. For cervical cancer, it's very important across country. We're encouraging all the young girls, teenagers, as much as possible, their parents to at least go and get vaccinated. The vaccines are here in the country now. Talking about STIs for a start, it's very important. If you have a discharge, you must come forward. And I see a lot of young females, female population. A lot of people, women come to complain about discharges. Discharges in women is normal. It's normal usually, most of the times, but sometimes when it's too excessive, it requires some sort of medical intervention or examination to give you confidence that yes, my body is okay. So it's very, very important. So if you have a discharge, please come forward. If you have an ulcer, please come forward. If you have a pain, please come forward. Don't delay it. Don't delay it, because this could be the early signs of HIV, trying to because earlier on when we said if your immune system is down, you will start to have common infections coming on frequently and with increasing severity. So when that happens, like, I want to encourage our youth out there, please come forward and at least seek some advice, get some information about yourself, and most of those conditions can be treated. And sometimes they are normal conditions and someone is worrying and sitting back. So, like, venture out and try and find that person that you can confide in and come and get those services. For TB, everyone who coughs, who has a cough, must come forward and at least give a spittle so that we can check the sputum, and we can check on the Genex platform. The turnaround time is very good. You can be diagnosed for a TB just from your sputum. So any cough, please come forward. And for the cervical cancer, it's very important for all our young girls, please. The impact will be seen in the next 5-10 years. You may be a teenager now, but you might develop cancer in future. So if you're listening to this, please talk to your parents, talk to your guardians or whoever support person that is looking after you. Get to the nearest place, seek that advice and get that vaccine. And if you are above the age of 19 to 35, please do a pap smear and know about your health. For our wider community, plus the young girls out there, females particularly, is 60% of the diagnosis that we've seen in 2024 is in females. So it's not among all the females, it's only among those females who have taken risk, the risk population. So 60% of infection is among the females. So what does that mean? That means we need to be empowering our young girls and women to make sure they are taking control of their own health. If they are exposed to a sexual risk, they must make sure someone who is having that sexual encounter must wear a condom. If that person that person must wear a condom, must have taken pre-exposure prophylaxis, and they must know the status. And if they have an STI, you need to take ownership of your health, because in 2026 I want to see the number in females coming down. There's 60% of the numbers is in the females, so it's very important. And the numbers that we have seen is indicating that the sexually active reproductive age group of 15 to 39 are infected in this 120,000. So you can see that if you are in that age group, you have a high risk of falling in, because that's your age group that's been exposed and now are on the radar. So be very, very careful. So the reproductive age group as well as the productive age group of this country are affected in this epidemic. So please, if you have a higher ambition, please pursue that ambition and leave other things for now and make sure you are safe. The other important information is for the pregnant women. The HIV prevalence or incidence of HIV in pregnant women is very high as well. It's about 1.5%. So about 2 out of 100 women that attend our clinics are positive. So it's very important, because if you are to say here that if you are pregnant, please do not hesitate to come forward. Always come forward. We are testing every woman that is coming across country. About 150,000 women come, and we've only tested 40,000, which means we need to up the game. Because once we test, we have the drugs, like I mentioned. We have a life-saving drug that can keep HIV positive people alive, but we can also keep the positive pregnant mother safe on the drug, and she can give birth to a baby who can be born negative. A lot of the babies that we are managing are born negative because their moms have been on the antiretroviral drugs. So if you're a young girl out there who is now pregnant, please do not feel ashamed of coming. Come to the antenatal clinic. We will test you, and if you're positive, we'll treat you, we'll counsel you, and we'll make sure that your baby is born negative. So now we are mounting with UNICEF support, we are mounting the HIV elimination of vertical transmission, the micro elimination. and that is going to be launched in this month to ensure that we put in a program to try and prevent, to reduce from 7 babies per day to at least 3 or 4, which could show that our interventions are working. But I want to take this time to thank you so much, and UNICEF, other development partners who have been working with the national program to help us try and drive this response foreign-wide.